Okay, so we're dealing with a high ankle sprain. A high ankle sprain is basically a separation between the syndesmosis, which is right here, between the fibula and the tibia. What happens is the ankle rolls inward and the talus pries out these two bones, separating the syndesmosis. Now, what I see most often is a lot of swelling. And you can still see, as we showed in the portion as we highlighted the foot, there's still some residual swelling, not much, but you can see the bruising in the toes from something leaking, bleeding. Now, when we see an ankle sprain, we tend to think that, oh, it's the posterior talofibular ligament or the anterior talofibular ligament, okay, which are irritated. However, when you see this much fluid, the only place that really has that much vascularity is the syndesmosis. It has a lot of blood supply. So when you see an ankle that comes in that's swollen, has a lot of swelling, you can pretty much bet that there is a damage to syndesmosis. That's a high ankle sprain. Everyone freaks out about it, gets upset by it. It's not a big deal. I'll explain why it's not a big deal here in a minute. Now, the one thing we had to rule out with this young lady here was we did not want to work on this until we ruled out a fracture. So anytime you're dealing with that much fluid, you want to make sure it's not a fracture because you want to be in there working, mobilizing, getting the fluid out if there's a fracture. There's not. Not one that we're concerned about, at least. There was some suggestion of one, but there's not. All right, so number 2 on this, once we have the separation, we get all the fluid, this fluid irritates normal healthy tissue. So this whole area in here is damaged and inflamed. So we have to get that fluid out. If you're not doing something to get the fluid out, it's not going to get better. This is one of the reasons why ice compression, the game ready, is not going to be the end all. It doesn't make it heal a lot faster. In younger kids it can, but as they start to get later on in the teen years and definitely collegiate athletes, we found that you have to treat the fluid. Now, one thing that this young lady noticed was a lot of sensitivity, okay? It's not just the ligament that's damaged, it's not just the tendon that's involved, it is the nerve supply. The nerves get irritated, sore, and then you add swelling on top of it. So the quicker you get the fluid out, get this ankle stable, the faster they get better. Now, so a syndesmosis, a high ankle sprain, is separation of the bones. What we do is we tape those bones together. Now, we don't make it really tight, we make it snug, because as you stand up, the syndesmosis spreads apart. When we tape that up, because of the tape, the syndesmosis can't separate. So, we protect the ankle, get stuff moving, but we don't allow that ligament to separate. This is how we're able to send people back to life, back to work, and back to sports much, much faster. Ankle braces, boots like she was wearing when she came in, they don't stabilize that ankle. They allow the tibia and the fibula to move apart. Okay, I think that puts pressure on the ligament, therefore it prolongs the problem, doesn't allow it to heal. The other thing that happens when you have all that bleeding into there, that's healing. So if we tighten it down and let it heal in that position, like I do with the AC joints, we'll go over that in one video, the ligament's tighter. We don't have a loose jointed ligament. Now the last piece of this puzzle for Sherry here is the peroneal tendon. That was strained when she injured her ankle. That tends to be a little bit longer of an issue initially, but you have to be able to separate, is it syndesmosis or is it peroneal tendon? The peroneal tendon gets confused sometimes with the posterior talofibular ligament. That's kind of a concern, but most of the time I find it's simply the peroneal tendon, treat the peroneal tendonitis. All right. Now, she's about 12 days out from her injury. She is now walking with one crutch. I thought we were about 4 or 5 days late, but if you get these athletes within the first 3 to 4 days, or get people within the first 3 to 4 days, they should be off the crutch within a week. I have my athletes playing usually by the 2nd week, if not the 3rd. But the key is when they play or they practice, you have to protect this ligament. That is the key. So don't get all confused and upset by a high ankle sprain. They're not that big of a deal. You have to treat the fluid, the swelling, and more importantly, keep that ligament stable while they're walking. Really important piece.
Okay, so when basically how this happened is I was helping somebody take a king-size mattress down the stairs, front stairs, went too fast, kind of tripped, missed a stair, and on the next step, totally rolled my ankle. I remember seeing it like sideways, then fell down the stairs. I instantly thought it was just totally broken. It made horrible noises, excruciating pain, and then of course it got better for like a second. Was able to get back in the house. Then it got much worse. Went to the ER. Spent the night there. That night they didn't give me anything for the pain, probably because I was, joking and stuff. Anyway, and so that night I slept about an hour and a half. I was in excruciating pain. It was on fire, and I was like, there's something seriously wrong with it. I've had broken bones before. I've never had anything hurt like this. And so having a little bit of medical knowledge is a bad thing, so I was thinking all kinds of horrible things that could really be wrong with it. Took some pain medication in the morning, was on it with crutches for a couple days, trying to move, pointing out things for people to do. It swelled up really bad and turned black and blue, and finally called you guys 6 days later, when you could basically no longer see any part of my ankle bone really on either side, and came in here, and you started treating me. The initial treatment of moving the fluid out was pretty unpleasant, I'll say.
Very painful, correct?
Correct, very painful, and not as painful as it was the first night, but enough to make me sweat. I have a really high pain tolerance, but yeah, it was extremely unpleasant. But after the treatment, even just walking out of here, of course that includes everything you guys did with the ultrasound and all that, it was already noticeably less painful. And I got home that night, and it was already feeling better, and to the point where the mass anxiety I had about the whole situation was already starting to get better, just because I could just tell that it was getting better. It's weird. Anyway, and then to now, where literally it's amazing. I swear a day and a half ago, this was black and blue, and it's barely bruised now. And I had a very, very, very thick ankle. It's still bruised. My toes are still a little black, but the amount of bruising that was there compared to what's now is dang near a miracle.
So again, we're 12 days out. The takeaway from this is it hurts and does not feel good to get the fluid out.
Correct.
But the faster you get the fluid out, the better they are. And here she is 12 days later. We're almost off the crutch. She's going to be going back to work soon without much of a problem. She'll resume normal activities probably in about 4 weeks after the injury. Again, we're about a week behind, but still pretty amazing for a high ankle sprain. But the takeaway is it doesn't feel good. The patients don't like it. It's not fun, but night and day difference. I've seen people come in here at 3 weeks after a high ankle sprain and still be like she was on the first day. You got to get the fluid out.